Thank you, Mr. Speaker, and I'm grateful to the Secretary of State for advance sight of his statement and for the clarity he has provided to the House this afternoon. Our thoughts, too, are with the families of the two young people who have so tragically lost their lives. I cannot imagine the pain they must be going through at this difficult time. This will also be an extremely distressing time for parents, students, staff and the wider community across the South East, especially as I understand 2 more cases have just been announced. Indeed, yesterday, friends of mine were very anxious about their own son, who was in the vicinity over the weekend. I also want to pay tribute to the NHS staff, public health teams, school and university leaders, and all those working at pace to respond. I welcome what the Secretary of State has set out on the daily publication of figures, the scale-up of antibiotic provision and the decision to introduce a targeted vaccination programme for students in halls of residence, alongside seeking further advice from JCVI. However, there remain a number of important questions. First, on the timeline, as there have been concerns raised out there. The Secretary of State has set out the sequence of events in detail, but can he be clear about the threshold used for wider public communication and whether that threshold is being reviewed in light of this outbreak? He also set out that head teachers were contacted on Monday morning. Can he clarify when those schools were first identified and whether there is a need to review how quickly educational settings are brought into the response, given that cases were identified several days beforehand? Secondly, on the nature of the outbreak, while many cases are linked to a single venue, can he confirm whether all cases are believed to be part of one cluster, or whether there remains a risk of multiple sources of infection? Thirdly, on escalation, given the involvement of both a university and schools, can the Secretary of State set out what criteria are being used to determine when more extensive interventions are required across educational settings? This situation will undoubtedly cause concern among families, particularly with the end of term approaching. Can he therefore set out what steps are being taken to manage the risk of onward spread as students return home? And what advice is being provided to families and local health services in other parts of the country? Can he also confirm that public health messaging is fully consistent across schools, GPs, local authorities and NHS services, so that families receive clear advice wherever they turn? And what steps are being taken to counter misinformation online where false claims may undermine confidence in public health advice? Can he also confirm that local laboratories, intensive care capacity and public health teams are fully resourced to manage any increase in cases, and that supply chains for antibiotics and vaccines are resilient should further clusters emerge? Finally, while I welcome the targeted vaccination programme and the decision to seek further advice from JCVI, the Secretary of State has acknowledged that most students would not have been routinely vaccinated against meningitis B, and protection among older teenagers is clearly not as strong as it is in infancy. Does he accept that this creates a particular vulnerability among older teenagers and young adults? And will he ensure that any further advice on eligibility or wider catch-up measures is brought forward as quickly as possible? Mr. Speaker, this is a serious public health situation. It is right that the response, though, remains calm, evidence-led and focused on protecting patients and supporting those families affected.